Welcome back to Made to Be Whole. This is week 2 of our ILADS wrap-up. Stay tuned as we discuss diagnostics and pathogenesis for the various diseases and conditions that we addressed. Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. So welcome back to week 2 of our ILADS wrap-up. Last week we talked about healing the terrain. Hopefully you are psyched out and ready for us to learn more about which things are helpful diagnostically and understanding a little more about how these diseases work and how they wreak their havoc in your body. So I'm going to just kind of go through my notes. So this isn't organized in a specific order, but there was so much good stuff. One of the things that I thought was useful, Dr. Eboni Cornish with the Amen Clinic, who was, by the way, just elected at this conference as the new president of ILADS for the coming 2 years. So congratulations to Dr. Cornish. She talked a lot about SPECT scans. So that's SPECT scans. She uses them a lot, especially if there's someone that's not getting better. It can give you a very, very good picture of what's going on in the brain. And it's a functional image of the brain. So let me explain what that means. If you have a CT scan, also known as a CAT scan, or an MRI, those are still images that look more at structure. You can see some things that are inflammatory with an MRI. There is such a thing as a functional MRI. It's not quite as compelling in the information it gives us as the SPECT scan is. The SPECT scan shows patterns of perfusion and can give really, really good clues as to what's going on. So I will give you a few examples. The result that comes back is this beautiful colored picture that indicates how much perfusion there is in certain areas of the brain. So perfusion is the fancy medical word for blood flow. So that can help us discern based on if something looks inflammatory, if we think, yes, infection is really driving that. There are signs on the SPECT scan that can show us if really toxins are probably a bigger issue, if a head trauma is the bigger issue, if sleep apnea is a bigger issue. She also gave the example of a patient who had been treated and had aggressive treatment for infections, but what the SPECT scan revealed was that this was a type of dementia that was not likely related to infections, and it was time to stop that treatment and focus on supportive care. That's, of course, not news that anyone wants, but that's really helpful because the treatment's very expensive, and if it's not something that's going to be helpful, we don't want to treat longer than we have to. So it gives some really, really good information. SPECT scans are not widely available. It's very difficult for them to get covered by insurance. So the actual cost of a SPECT scan is between $3,000 to $6,000. The rates that a lot of hospitals charge when things are getting billed to insurance is over $20,000. So this is something that I think for most individuals, you would be better served by finding a clinic that provides these and that you could order them and pay cash if you have the resources to do that. I know it's a big chunk of money, but I just want to take a step back about insurance companies. I've had this conversation with you before. You have to have realistic expectations of what your insurance company can and is willing to do for you. You're going to expend a lot of emotional energy getting worked up about the things that you think they should do versus what they will do. And there's some things you just need to let go. The analogy I gave before is if we looked at it a little more like car insurance, that it's there for catastrophic things, but a lot of this maintenance is on you. As a practice, we will do some prior auths for things that we have experience we'll go through. But for example, if we have someone who's doing IV antibiotics, if they don't go through insurance for their meds, we charge at this date $125 to get that all set up, because there's still quite a bit with scheduling the placement of a PICC line and ports, a lot of nursing time. If you want us to go through your insurance company, we will try, but there's a $500 administrative fee. I'm not trying to be a monster. It was difficult for us to come to that conclusion, but my nurses can spend 8 to 10 hours at least going back and forth, because here's the process. If you don't have insurance paying for your meds or other stuff, all I have to do is send an order, and then it gets scheduled, or the pharmacy sends you the medication and gives you a transparent price and the bill. If you want insurance to do it, we have to first get the procedure itself prior auth. We have to then set up for home care nursing or an infusion center and hospital to do weekly dressing changes. We have to then order the medication, and then we have to find out from your insurance company which infusion pharmacies they actually approve. We have to see if that infusion pharmacy covers your area, and then we have to see if the infusion pharmacy will cover that medication. Now, in addition to that, most of these people won't authorize their step until they know the other steps have been taken care of, and they don't talk to each other. It is a logistical nightmare. I'm happy to give it a try for people who want to pay the administrative fee, but that's why we do it. It is so stressful and time consuming for our nurses, and it takes away from their ability to do other things. So just a side note on that. The same thing I think is going to happen with this SPECT. I do have a few people with advanced enough neurological issues that I will order and I will try and see if it goes through, but we are not going to spend hours and hours during prior auth when I've been told by people on the other line during prior auths, hey, this is just a checklist. I don't really have that much authority. Either I check the boxes and the formula says yes, or it doesn't. And the other thing you have to keep in mind is they're much less likely to cover anything that they don't say exists. So if the CDC says there's no such thing as chronic Lyme disease or chronic babesiosis, then they're not going to cover it because in their mind it's not a real condition. So even though it's like maddening, you're going to spare yourself a lot of stress letting go of what your insurance company should do for you and figuring out how you want to proceed. And in that way too, my rant, I guess, isn't over. Sometimes you're actually going to pay less paying cash than you would for your copay with your insurance company. You might get an MRI approved, and then your insurance says, we'll pay $4,000 of it. It's a $2,000 copay. And I can almost guarantee you I can find you a copay someplace that doesn't take insurance for less than $2,000. So sometimes it's in your best interest just to use your HSA or your care credit, or if you have the resources to do it, and just get it done with and let it apply to your out-of-network deduct. So, rant over. The SPECT scan, Dr. Cornish says, in her mind, is imperative for patients that are stuck. So, keep that in mind, especially if you're stuck and you have a lot of neurological symptoms. Now, getting onto the blood vessels themselves, understanding a little bit about vascular information, Dr. Mozeyani, who is the human Bartonella guru and the founder of TLAB, he talked about neurovascular inflammation and complex chronic illness. So neurovascular. So vascular, that means blood vessels, and neuro means your brain. So we're talking about the blood vessels in your brain. Neurovascular inflammation is a big, big deal. He talked about how we can have symptoms of vascular disease that are not central nervous system symptoms and appear like they're neurological manifestations, but it might be more related to the vessels. So fasciculations, which are those tiny little twitches where your muscles are just real quick, flip, flip. So people will have fasciculations in their extremities. I know a lot of us with Babesia have had them around our eyes, but it's not necessarily the nerve itself. It could be related to inflammation in the blood vessel, neuropathy in the long neurons, foot pain. So he made the statement that if it's bilateral foot pain, because foot pain is super, super common with Bartonella, very atypical foot pain, it is more toxic or metabolic presentation. If it's asymmetrical foot pain, meaning not the same on both sides, it more likely has a vascular component related to that blood vessel stuff. I've talked to a few patients just this week. We tend to have this, Well, you know what you know, and so, but numbness can be caused by neuropathy or nerve damage. So people have numbness and they automatically assume that it's neurological, there's nerve damage. But I very, very commonly see numbness, especially numbness in the hands and arms, sometimes the feet, associated with Bartonella and treatment as a herx because you have this vascular inflammation. It happened to me when I added rifabutin to my treatment for a good extended period of time. I would wake up in the middle of the night with numbness in my hands and arms, and it was pretty significant. I mean, it woke me up, first of all. I had to shake it out. Now, if you look at that from just the traditional view, people say, well, hand numbness in the middle of the night, I mean, that's probably carpal tunnel syndrome, or you've developed some other form of neuropathy. But I knew in my head, okay, what precipitated this? What was the instigating event? It was starting rifabutin. What does rifabutin do? It's very potent against Bartonella. What do I know about Bartonella? Bartonella is a vascular inflammation. So if, as part of die-off, I have increased inflammation in my blood vessels, it's very possible that where the smallest blood vessels are, if you think of your little hands and feet, that inflammation could affect blood supply, which could make me have numbness and tingling that could mimic neuropathy, but I know this is actually infection related. It's a difficult position because a lot of patients with complex chronic illness have had to become their own care provider, not by choice, but because you've already been to a lot of people who've given you bogus answers. But then some people are afraid to take that hat off and they think they have to figure everything out on your own. And you don't, and you can't. Neither can I. We all need help. That's why I spend a lot of money and a lot of time going to conferences and learning and reading and talking to people, because I know I don't understand it all, and I'm trying to expand my pool of knowledge. So Bartonella suppresses the immune system. Does that sound familiar? But it can cause non-specific IgM activation. This is really important, and I remember learning this at my first ILADS conference. If you have been treated for Borrelia, for Lyme disease, and you have persistent IgM antibodies, so your antibodies, remember, are footprints. They're just proof that an infection's been there. IgM antibodies typically are what happens first, and they happen early infection. IgG antibodies typically happen if an infection is chronic or if it's been treated and resolved in its past. So if you've had Lyme treatment, but you still have positive IgM antibodies, think Bartonella or other infections. But Bartonella is known to cause these very nonspecific IgM elevations in other infections. He said that whenever he looks for Bartonella in tissues, they find it. So that includes your skin. TLAB does have the fish testing that we've discussed, that you can do a skin biopsy, and they have found it both in lesional and non-lesional skin. So what that means, we've talked about how Bartonella can cause lesions. It can cause atypical striae, which are these stretch marks. So when they've biopsied the skin that's abnormal, they've found it, but they've also found it in non-lesional skin, the surrounding skin, or even sometimes in patients who don't have these bizarre dermatological symptoms or presentations with Bartonella. It can sometimes be found in the skin. He made a point that I thought was really interesting. If you think again about this numbness and vascular inflammation, your capillaries, which are your tiny, tiny, tiny blood vessels, are only as wide as one red blood cell. So if you've got inflammation that's extending all the way into those capillaries, you're going to have impaired circulation. Your hands are going to feel numb. Your toes are going to feel numb. And that's why, and that's not hopeless. If it happens as a result of treatment, in my mind, it's because treatment's being effective. We do supportive things to get you through it, but it means we're getting there. The Bartonella striae, by the way, is caused by collagen damage. As far as diagnostics, Dr. Mozeyani started TLAB, which I've talked about extensively, and I talked about the conference, agreed to come on at some point to talk to us about TLAB. But he described what happened with one of my sons, where you put the tourniquet on to do a blood draw. The veins distend. That's why you do the tourniquet, because it makes the veins bigger, that pressure, like a dam. And because of that, these long biofilms will slide out. And this happened for one of my boys. We got the biofilm report back and it had what looks like a purple worm on the slide. And I called Dr. Mozeyani's lab and said, help me understand what I'm looking at. Sometimes that biofilm can line the inside of the blood vessel. And if you're lucky, you'll capture that. But just think of that. If I can see this picture on my son's labs of this tube that looks like a worm, and that's giving me the picture that he's got this inflammation, all his blood vessels, that's going to affect how you feel. And it's not a fast, easy fix. It is absolutely not. He talked, and other providers talked a lot about the glymphatic system. The glymphatic system is the lymph system of your brain. I think it is a huge contributor to the cognitive symptoms that some people have, the pain. Think about it. You have a lymph system. Most people know you have lymph nodes, places like your neck. You can feel them if you get sick, if you get strep throat, they get swollen. You have lymph nodes. They're everywhere, but the big ones we think about are in the neck, they're in your armpits, and in your groin. And sometimes those get enlarged due to infection. If you have asymmetrical lymph node involvement and the lymph node is fixed and hard, that's a problem. So I will translate that for you. So asymmetrical meaning one side. If it's fixed, meaning you can't move it around. And if it's not rubbery, it's firm. That's a sign of cancer. That's something you need to get checked out. But if you've got bilateral lymph node involvement, if your lymph nodes are soft and sore, that's probably an infectious process or another toxin that's just overloaded the lymph system. Your spleen is part of that system. That's why there's a fair amount of splenic tenderness. Your spleen is on your left side under your ribs. So we try to support detox, but there is actually some really cool transcranial Doppler. I would love to be able to do this at some point, where transcranial means through the skull, or you're looking at the blood vessels of the brain using a Doppler, which is an ultrasound. So there are a lot of cool diagnostic modalities out there that aren't really mainstream, done a lot, necessarily covered by insurance, but they can give us a picture. The other thing, before I move on, that Dr. Mozeyani said about biofilms, and if you remember, he's got that BNR report with TLAB that lets you look at your biofilms, but he described biofilms as a community of organisms. And I think that's a very, very important distinction. So biofilms are usually polymicrobial. Poly means multiple, microbial means bugs, germs. I've had people look at their results and they want me to tell them, is that a Lyme biofilm? Is that a Bartonella biofilm? Is that another kind of biofilm? There are bacteria that produce biofilms. The body produces biofilms in response to some of this, but they're kind of non-selective in what they're going to suck and take in. A biofilm forms in any bacteria. It's going to get taken in there for safekeeping and likely thrive. So that's why with treatment, it's very, very critical that you don't break up biofilms before you've got your immune system ready to deal what's coming out and you've got treatment on board. Alexander Ring, moving on, he talked about using EEG, electroencephalogram. It's what you do when you check for seizures. You've seen the little leads all over people's heads. Helping us shift to a more functional paradigm. He was able to use the data from EEGs to make kind of a connectivity map. And he's able to look at different waves that are more activated or overactive. And like alpha activity, for example, you have alpha waves, theta waves, beta waves, all these different waves. But alpha activity can be used as a biomarker in inflammation. Again, fascinating that you've got people who have used all of these different modalities that can give us data. And hopefully, instead of being overwhelmed or think, oh, I can't do all those things, the point is never for you to do all these things. It's to figure out what could be helpful in figuring out how you feel, why you're progressing or not progressing. And it gives you a way to map progress too. So there was a lot said about mold, fungi, toxins. Dr. David Corey, I thought this was a really fascinating lecture, talked about how in most cases of asthma and sinusitis, there's a fungal component. And I have found this as I've done cultures. So I really prefer two types of testing for doing the culture of the nasal passages. If somebody's got chronic stuffiness, sinusitis, any of this sort of thing, you can use either microgen, which I've talked about for the UTIs, but you can send them anything, and it's DNA PCR testing, and they're looking for both bacteria and fungi. And then they give you a species list and give you some information about what these things are susceptible to and if there are any resistance genes detected. We don't see a lot of resistance with antifungals, thankfully. There's also a company called Microbiology DX. They are the ones that do the Marcons testing, which is pretty common in someone who's got mold issues. Pluses and minuses of both. So Microbiology DX, if you have insurance that is pretty good at coverage, I can frequently get it covered. If I have a Medicare patient, I'm always going to defer to Microbiology DX because I can usually get it covered. Other insurances, it seems to be hit and miss, but it's a very sensitive test. Microgen's cash price, I think it's $259, but that's a fair price for what you're getting, because if you do a culture through your hospital lab, first of all, if there's more than a couple of germs, they say it's a contaminated sample or mixed microbiota. And well, yeah, we want to know what all it's made of. They also, a fungal culture is extra. Their fungal cultures aren't as sensitive. And then they tend to charge you per pathogen. So as many things as they find, your price is going to be higher if you don't have insurance covering. Versus Microgen, it's a set price. Microbiology DX that does the Marcons testing, plus they do look for other bacteria and they look for fungi. It is, I think it's like 180 to 260 depending on what they find. So if you don't have insurance, that's a great test too, but it can give us like much more helpful information. Did I say that? Information. So asthma, same issue. He is finding most of the time a fungal component. Now, that being said, with standard culture, 0 to 10% of people are coming up with positive fungal cultures. But in his study, they found 75+% of asthma patients had fungal issues, and they found hundreds of species. But they've got a broader species library, and they're looking for more species. Remember, cultures are only looking for a set number of organisms. You can also do fungal IgE testing, which is a blood test, which indicates that there's something going on. So again, really, really exciting. He does not really come at this from the context of vector-borne infections, but if we're looking at the terrain, if somebody's got persistent fungal issues, you want to get that taken care of, and those tests are easier generally to get covered, and a lot of those treatments are covered. Now, you do sometimes do some compounded sprays that can get a little more expensive, but you know, that's all right. You cross that bridge when you get to it. I know for my son Daniel, who had positive Marcons and another bacteria that was there. And I will give a little side note on Daniel's positive nasal culture. The main bacteria that came back was the bacteria that was in another family member's chronic respiratory infection. Said family member had continued to insist that they were not infectious, but the crap they were coughing up was in my son's nasal cavities. So cover your coughs, people. We will go on. Tatiana Mijatovic, I hope I'm pronouncing her name right. She's a PhD, and she's actually the director of Red Labs. They are the ones that do phage testing for these infections, which is really kind of cool. But she made a couple of really good points. She said that it's important to combine direct and indirect testing to look for microbes and the host immune response. So let me translate that. Direct testing is what T-Lab does. It's FISH testing, fluorescent in situ hybridization. You also have FISH testing available for Bartonella and Babesia through IGenics. Indirect testing is like the antibodies, looking to see are the footprints there. So what she's saying is if you combine those two, you're going to be most successful in not only finding what pathogens causing infection, but seeing if your immune system has responded. If you have a positive FISH test and a negative antibody test, your body has not mounted an immune response. That is also why, however, if somebody is just choosing one method of testing, if I have someone who I know is immunosuppressed because they have an autoimmune disorder, because they're older, because they've been on immunosuppressive medications like steroids, I'm not going to waste their time with antibody testing. I'm going to do the fish testing. Now, IGeneX has, and for my patients who do IGeneX, I always recommend the 5-1B panel because it combines it. It has antibody testing for Lyme disease, tick-borne relapsing fever, Babesia, Bartonella, Anaplasma, Ehrlichia, and Rickettsia. So it's got antibody testing for all of that. Plus, it has fish testing for Babesia and Bartonella. And it is not at all uncommon for somebody to have either fish positive and antibody negative testing, or the other way around. They've got positive antibodies, but it wasn't found in the sample, which is totally a shock because it's got to be in enough circulating blood. And we know some of these infections are also in tissues, but it's really, really helpful to have both, because back when I just did antibody testing, I was missing people. You can still make a clinical diagnosis, but I think better labs save you time and money because we don't always guess right, and guessing is expensive too. Now, the argument you will hear from the infectious disease community writ large and critics are, well, they came to the hospital and we did PCR testing, polymerase chain reaction testing, and it was negative. They had a negative PCR test. I've been lectured and patted on the head. That means they don't really have the infection. So, Dr. Tatiana said that Bartonella, less than 1% are PCR positive. Now, you have one really, really good PCR test for Bartonella. That's by Galaxy Diagnostics. They have an enhanced PCR test and the ability to do a triple draw, which means you're checking 3 different times because that gives you increased ability to find it. Immunoblots for Bartonella are 43% sensitive for IgG and 22% for IgM. So again, combining methods. PCR testing, again, this is what the hospital tell you to do, less than 1% positive by PCR testing, but the immunoblots, 36% of it will get caught IgG, 50% IgM. But again, we've got the fish testing. That helps us out tremendously and has been a total game changer. Now, I know that everybody wants to hear about mold and mold testing. I will give you kind of a rundown of what Dr. Nathan does. He uses urine testing. That's his preference. The 2 main tests are Real-Time Lab and Mosaic, which used to be Great Plains Laboratory. There are some people who say, hey, you can order all of these different markers from the hospital and these biochemical markers. But the reason that he does not use that is he said the biochemical markers indicate a certain type of inflammation, but is not specific enough to help us figure out which mycotoxins there. It's not a specific testing. And also, that type of inflammation could be triggered by mold, but it could also be another toxin, one of these other environmental toxins. Now, Real-Time Lab and Mosaic, even though they're both good companies and good urine tests, they're different. Real-Time Lab, which is now Biotech Laboratories, is ELISA testing, and Mosaic has mass spectrometry. So what you don't want to do is compare apples and oranges. Even though they're both good tests to detect mycotoxins, they're working a different way. So when you take this test, you can just take it, or you can do provocation, meaning you're trying to stimulate your body to start clearing those toxins so that if they're there, you get a positive test. What he typically uses is have people take 500 milligrams of glutathione twice a day for 7 days and then collect the urine on the morning of day 7. You could also use heat, like a sauna, a hot bath, a hot tub, the night prior to collecting to stimulate clearing things, or you could combine the 2. I will say, though, when somebody's very, very sick, and he referred to this too, they're not going to be able to handle the detox protocols. So it's going to be difficult because if you're super sick and you start moving toxins, your body's going to just say uncle. So his recommendation in those cases, if you're too sick to do the provocation, or if the provocation makes you sick, you start glutathione and you feel like you're dying, just stop it, take the test. Now, one of the things that you will hear critics say is, hey, this mold is everywhere. You know, ochratoxin can even be found in healthy controls. And he gave a statistic I thought was interesting that ochratoxin was found the average level on average of 1.6 nanograms per gram in the healthy controls versus 18 nanograms per gram in sick patients. So yes, it is possible somebody could have some detectable levels of mycotoxins and not have mycotoxin illness, but usually it's a matter of degree. He also mentioned with the environmental testing that you do for your house to remember that mold spores are heavier than air, so it's not always going to be found in the air. You also have to check the surfaces. Those mold plates are kind of a good cheap place to start. You can purchase these, you put them in various areas of your house. A little pro tip, he said, if the mold is found in equal amounts or uniform amounts throughout the house, it's probably in your HVAC system. So you don't necessarily need to look further in case there's something obvious going. Um, there's a lot more. I think I'll probably stop more for this episode. I just wanted to give you a little taste of the things I learned about diagnostics, about how these diseases work, and to give you the hope that people are still looking, they're still researching. There's a lot of information out there. So remember to have hope because you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.